박백호 교수를 모셔서 중독 예방을 위한 폐해 감소 전략의 철학과 실제에 대해서 발표 부탁드리겠습니다. 감사합니다.
Thank you very much. Good afternoon, ladies and gentlemen. First of all, I would like to express my sincere thanks to the local organizers for giving me this opportunity, as well as for the famous Korean hospitality. I thought today I will share with you something known as harm reduction. I was very encouraged to find that many previous speakers, including the Honorable Minister in the morning today, did refer to the concept of harm reduction, but I thought I will make the entire focus of my talk on understanding the philosophy of harm reduction. When we say harm reduction, the first word in this is harms. So what exactly are harms? Why do we think that addictions are bad? We know that all addictive behaviors are quite pleasurable. All of them are quite fun to engage in, be it drinking, smoking, taking drugs, playing games, or gambling. All of these are indeed very pleasurable activities, but the problem is, if you keep engaging in these activities repeatedly, you tend to become addicted and dependent on them, and that's where this pleasure turns into experiencing various harms. And what kinds of harms are expected of various addictive behaviors? A wide variety. So there are physical harms, there are mental harms, social, occupational, legal. In fact, no area of life remains untouched when a person becomes dependent or addicted to various such behaviors, including psychoactive substances, as well as gaming, as well as internet. The question then is, how can you reduce, how can you manage these harms? For this, we will need to decide, are all of these harms equally harmful? Or can there be some harms which are more harmful, some others which are less harmful? For instance, can there be some priority among these harms? For instance, if I ask you, if you were to become leaders, administrators of a city in Korea, and you are told that your society, your city is suffering from such harms caused by drug addiction, drug use in your area, what would you do about it? How would you think about which harm to be tackled first? For instance, drug use can lead to poor role performance and unemployment in the society. There may be various family problems, stigma. People may engage in criminal behavior and do illegal activities. Similarly, there may be risky behaviors, and communicable diseases like HIV/AIDS may spread because many injecting drug users may share their injecting equipments and may spread HIV infections. So how do we decide which of these harms is a priority? Most public health professionals would agree that a largest number of people in a society, because of their drug use, will be affected in this way. There will be large number of people who will not be able to work properly. Possibly there will be high unemployment rates in the society. There will also be family problems and stigma because of drug use. Finally, there may be people engaging in various risky behaviors, including many illegal activities. A small minority would also suffer from communicable diseases like HIV, but these represent a very high degree of public health harm. Because once HIV infection, HIV epidemic sets in among injecting drug users, you need to tackle it to prevent spreading from other members of the society. And hence, harm reduction concept actually teaches us how to choose between different levels and different degrees of harms, and how do you address those harms. What could be the strategies employed to reduce or prevent these harms because of drug use? World over, historically, the human society has been trying to manage the drug use problems by a combination of strategies which can be grouped under these headings. First of these strategies is known as demand reduction strategies. Wherever drugs are used, there is a market of drugs. There are some people who are interested in selling, making drugs available. There are others who are interested in purchasing, buying, or consuming these drugs. So first strategies are demand reduction strategies, which work with the consumers of the drug, which works with the users of the drug and try to reduce drug use. Then there are supply reduction strategies, which sort of try to limit the availability of drugs or alcohol or other such addictive phenomena. And the third is harm reduction strategies, which I am going to talk about in a little while. So let's look at the demand reduction strategies first. The demand reduction strategies are those which aim to reduce the desire or the need to take drugs. This is done by primary prevention. If you teach our young people not to take drugs, they will not start using drugs. Ultimately, the harms will be reduced. And finally, if you identify people who are currently addicts and provide right kind of treatment to them, many of them may be able to perhaps reduce or stop taking their drugs, problems will be reduced. Then this is followed by supply reduction strategies, whereby you either try to regulate some legal drugs such as alcohol or tobacco by taxation and by some other laws, and declare some drugs as totally banned, totally illegal. Their sale, consumption like heroin, cocaine, etc., not allowed anywhere. It's the third type of strategy which I want to all of us to focus upon, which is known as harm reduction. What does this actually mean? Harm reduction is basically name of a philosophy, a way of thinking. Those policies and programs which are aimed at reducing the harms of drug use, but not drug use per se. Now, this is for some people quite a radical thinking, because everyone would agree that ideally there should be no drug use at all. How can we allow people to continue taking drugs? That's what exactly the harm reduction philosophy tells us. It is okay even if people continue to engage in addictive behaviors, if you are able to reduce the harms of such behaviors. It means reducing the harms for drugs is even more important, and in fact, this kind of way of thinking, this kind of philosophy is likely to be much more effective, much more work on the ground, because it's realistic, it's pragmatic, it seeks to achieve what you really can, rather than just talking of an ideal utopian world which you can't achieve. So 80% of something is better than 100% of nothing. Because many people keep giving us rhetorics of a drug-free society, a drug-free India in my case, a drug-free Korea perhaps in your case, but we know it's perhaps something which is not achievable. Why? Why can't we totally eliminate drug use from our society, our community? That's really a question which many people have tried to answer. The simple answer is some or the other form of substance use has always been a part of human existence. We human beings, when we stopped eating animals and started consuming plant products, that's the time when we learned that there are some plants which give us pleasure. There is some grains or fruit juice which left in the sun gets rotten, it's bitter in taste, but gives us pleasure. And since prehistoric times, human beings have perhaps been using various psychoactive substances, and additionally, all the zero tolerance based approaches, which means total ban, total prohibition, not allowed at all, have not worked anywhere. Many countries around the world have been spending billions of dollars every year in the supply control, law enforcement approaches, and they have not been able to reduce or control drug availability in those countries. And hence, in fact, if you make some drugs illegal, the drugs are pushed into illegal market, people spend more money to procure them, people may engage in other criminal activities, and hence, your net harms are even more. So what do we learn from this? A drug-free society is something which is impossible to achieve. As a result, there will always be people who are using drugs. Some of these people may try reducing drugs, but they will not be successful, and hence the harm reduction approach gives us an opportunity to engage with such people and give them some help, so that at least even if they continue using their drugs, even if they continue to engage in risky behaviors, at least the harms are reduced. That's what harm reduction tells us. Now the issue is, what could be the examples of harm reduction? For instance, if people are using drugs through injecting route, you can supply them clean, sterile needles and syringes, so that even people continue to inject drugs, they will at least do it in a safe manner. Many countries around the world, including my own country, does it to prevent the spread of HIV/AIDS. Similarly, for people who have been drinking very late at night, if public transport is available, good public transport late at night, perhaps the risk of their driving under the influence of alcohol, that will go down. We have not stopped here someone from drinking, just stopped a consequence of harmful drinking. So that's what harm reduction, how it applies to illicit drugs. The question is our burning problem, which means Korea's burning problem, internet addiction. How do we apply these principles of supply, demand and harm reduction in the Korean context for internet or gaming addictions? Supply reduction. Can we really think about blocking addictive games or websites? Can we really think about reducing the speed of internet? Are these really logical, pragmatic solutions? Answer is no, obviously, because we all crave for, we have very high appetite for more and more speed of internet, more and more content being available. But demand reduction, yes. We can enable young people, youth, to develop alternate source of engagement with each other, find alternate and pro-social ways of dealing with things rather than engaging in gaming behaviors. We can provide help and treatment to those young people who are already affected by internet and gaming addiction. And finally, we may think of some innovative ways of how to we develop and design content which is available, the material, the games, the websites, etc., perhaps, which reduce the risk of addiction. Also, there may be some specific psychotherapies which may be engaged, which may be provided to people so that the harms of engaging in such behavior that go down. This is something now we all must realize that no country in the world has been able to control addiction simply by applying laws, forces, etc. We have to devise innovative methods. We have to ensure a judicious balance between supply, demand and harm reduction strategies to reduce the overall harms caused by addictive behaviors. Now, what could be those innovative strategies for harm reduction caused by internet or gaming addiction? I don't have any definite answers yet. I think overall in the world, no one has definite answers to this. I am sure in the local context, a group of intellectuals like this great scholars under the leadership of Addiction Forum may sit together and provide some solutions, some answers, some innovative ideas which can be implemented pragmatically in the Korean context. So most addictions give us pleasure, but they are harmful. We must ensure a balance between demand, supply and harm reduction strategies. We need to think about innovative strategies which can be employed pragmatically on the ground in Korea. Thank you very much, ladies and gentlemen.
네, 감사합니다. 사실 함 리덕션